Okay, hello. Here we are with Daniella Bonatto, based in Brazil. I'm so happy to be here with you. We were reflecting that we have known each other since around spring of 2020. Um, I somehow became connected to you online at the very beginning of my work with pedestrian space, and I have always been interested in the work that you do. You're a professor and researcher, and today wanted to talk a little bit about the work you do and the specific focus on elderly health and walkability. So let's just begin. Thank you for being here. Maybe where you are, because I think it's fascinating learning about your location as well. You post gorgeous pictures um, of your location. So where you are to begin with.
First of all, thank you to this invitation. I'm really happy to finally meet you and take a, a conversation. Now I'm based in Vitória, Espírito Santo. I'm a professor here at Federal University of Espírito Santo, and I've just came back from Portugal. I spent 1 year there, one year researching my PhD at the Universidade do Porto.
Okay. And so the work you do and the reason we became connected in the first place is because your work revolves around a few different themes, but one of them is walkability. But maybe you could share the different dimensions of your work, the different themes that you work with in your research and teaching.
Thank you. I am fascinated about the public spaces. So I have a different approaches in the research and also in the education course that I gave in the university. And in the researches, we have the approach of sustainability, of course, but we study the distribution of public spaces, mainly green public spaces and public space of leisure. And we study the distribution, the quality on access, and green infrastructure. It's an approach we used to do. And also in the studies of inequality in this distribution, even spatial inequality and racial and in the low income distribution. And then recently we start to study sustainable indicators, and we work together in two fields, the green areas and the other field in mobility, urban mobility and sustainable urban mobility. And then we are looking for, especially for the active mobility. So we have studies about cycling, and recently for walking studies or walkability.
Okay. Also, how does this all connect to, I know one of your central areas is also health. So elderly health, for example, I have your article pulled up here, the application of walkability index for older adults' health in the Brazilian context. So it'd be interesting to hear about how all these areas intersect as well in your research for elderly health.
Thank you for the question. Before I being at Federal University, before I be a professor, I worked 10 years at Rio de Janeiro in a NGO center. And then in that moment, we worked health promotion. And the main idea is to see health as well-being with social and mental and physical health. So the health promotion is based in different pillars, but one main thing we need to focus is that the environment can produce health or avoid health. Thinking in this particular idea, we can think that health is constructed on human biology and health system, but most of all in the environment, build the environment and nature environment, and in the lifestyle also. But lifestyle is not exactly a choice, because there are a lot of people that don't have choice to have a healthy lifestyle. But the neighborhoods, the city can improve this. So the public spaces are the main places that we can live, we can meet each other, we can gain force as a social group, and where we can develop our human skills, or your body development and social development, and as well our mental health. So we have a lot of studies that relate relations public spaces or green spaces, green public spaces to health. And good public spaces are good to walk and are good to physical activities, are good to improve mental health, and to improve the capacity to get old, to aging with health. So I think the connecting, it seems like we are talking about a lot of things, but to me, it's all about public spaces and how amazing that can be to the city life, to the vitality of cities, and to join the cities, and to health, of course, and to happiness as well.
That's really wonderful. I love how they all, it is a lot of dimensions, and they all intersect. And I like how you rounded up that they all intersect in this area of public space. So also, I know that the paper and the work you do, it's about, promoting urban mobility too in older populations. So what are some of the challenges that you also might explore in your work that maybe elderly populations particularly face with walkability, some of the obstacles in urban areas?
So I think the biggest challenge is the aging population, international aging population, and in the fact that cities are not proper to this reality we face. In Europe, people get older early, but here in the South Hemisphere, we are getting older faster than you reach this situation there. So even there are a lot of reports that says we need to change the cities to prepare there to the aging population. But here we as we are going fast to the aging situation, we have much more hurry to do this, and we have different conditions because of a lot of things about something like the big diversity of cities, big inequalities that we can see spatially but socially as well, and even about the management of public spaces. The actors that are involved are a little bit different because we have here the public spaces are public, but the sidewalk is not beside the sidewalk is public, it's not I don't know how to say. Just a moment, I will fish the word responsibility.
Okay.
There are not a responsibility for the mayor or the public management. They are responsibility for the owner of the
building.
place, the building. Yes, the bed. So we have a big problem on this because who will turn the sidewalks proper? And we know that walkability, it's not about just sidewalks, but sidewalks is the first
condition, yeah.
Yes, the first condition or priority too. It's the minimum quality you have to take care for people go around walking. And walking is very important to the access of the city, to reach everyday tasks, everyday activities we have on the city. So if you can't walk, you can't reach the places you need to live. And as we get old, as we age, the mobility difficulties are greater, are bigger. So we have different components in integrating that difficult or turn easy the walkability for the others. Then we have also 2 decades of this discussion about age-friendly cities and health aging, and this is all about the environment in the cities and how cities can be better for people and better for aging and living cities. I don't know if I answer you properly.
Yeah, I think so. And it's really such a big topic as well, and such a critical one that I will look forward to talking with you again later this year. Maybe we have a webinar with a few different people. The network we're developing, the Walkability Network, already has a bit of representation in Brazil, including yourself. So I'm really excited with the expertise that you're able to share and we're able to learn from. I think I want to ask one more question, and on one question, which is what motivates you with this work? How did you get involved with it, and what I can feel your enthusiasm for it as you talk. So what motivates you with this work?
Thank you for this question, because it's I think it's very important to remember this always. And first of all, I start to think about green places because I was invited to take part in a research when I restarted to being a professor, and then I heard about green infrastructure, and it made all sense for me to think about green places in the city, and it was a kind of intellectual approach, because I was invited and I never heard about it, green infrastructure in that moment, but I was making connection with my life since I was a child, and when I started to talk about this connection with between green spaces and health, I realized that all my childhood I spent near to nature and walking in the city, because I know it was a different time. It's a long time ago, but I was realizing that all my enthusiasm and all my approach to the city was based on my previous experience in my childhood. So I was amused about this, because I didn't realize this. Then even when I start to talk about this with people and start to talk about this in the classroom, I realized. So it made me more enthusiastic.
Yeah.
Thank you, about this fields, and I started to connect about with health promotion that I think was lost in my past as well. 10 years just before, since 2000 till 2010, I worked on this, but when I started to teach in architecture and urbanism graduation, it was like I was forgot this work, because it was different that I started to make here. But then I was connecting things together, and then everything makes sense to me. So I think we need a quality places, quality cities to be happier, to get older, to be happy, and to be healthy.
I think that's a beautiful place to end this particular talk and say thank you. And I look forward to further talks with you and hearing more about your work. So thank you. Thank you, Daniela.
Thank you very much.